sick!
Oh no! What seems to be the problem with Bindi?
Well, she's had bloody diarrhea the last few days and isn't eating as much.
It also looks as if she's lost weight since her last checkup, which is uncommon for a growing puppy.
Okay, let's get Bindi onto the examination table and take a look. I'll do a physical examination to make sure everything looks okay. We'll also have Lindsay draw some blood and gather a stool sample to see what's going on.
Physically, she looks okay. She has a little bit of tenderness and sensitivity in her stomach. It looks like she may be biting her paws a bit and her red blood cell count is low. So we are going to do a fecal flotation test to analyze Bindi's stool to look for any type of parasites. I suspect it may be roundworms, tapeworms, or something of the sort.
What is fecal flotation? Is Bindi okay?
A fecal flotation is actually a routine test we do in the clinic to see if a dog has parasites or worms. We'll place Bindi's stool in a test tube and combine it with a sodium nitrate solution called Fecazole that will cause her stool to separate and reveal any eggs or larvae that were excreted.
The mixture will then be covered with a glass cover slip. The tube will then be spun in a centrifuge so that any eggs and larvae stick to the glass cover slip. If Bindi does have any parasite, we'll be able to identify it after looking at the glass cover slip under the microscope.
Here we can see a second method of fecal flotation being done. Bindi's stool is placed into the test tube and is combined with a sodium nitrate solution, Fecazole, that forces the material in her stool to separate, revealing the eggs and larvae that could possibly be in her stool. The tube is then filtered and topped with additional Fecazole until an inverted meniscus is formed. A cover slip is placed on top of the meniscus and left to rest for about 10 minutes. Any eggs or larvae will float to the top of the test tube and stick to the cover slip. The cover slip is then placed on a clean glass slide to later be examined under a microscope.
So, after analyzing her stool, we have determined that Bindi has Ankylostoma caninum, also commonly known as hookworm. It is a common type of parasite among dogs.
I'm not sure I understand. What exactly does it mean to have hookworm?
Hookworms are a parasite that live in the small intestine and can cause inflammation or even anemia. The hookworms bite into the small intestine, leaving bite sites, which will cause your dog to lose blood. The parasites do this by sucking the blood from the intestinal capillaries.
Normally, the digestive tract goes through 6 different phases: ingestion, propulsion, mechanical digestion, chemical digestion, absorption, and defecation. The digestive tract is composed of the mouth, esophagus, stomach, small intestine, large intestine, and anus.
The small intestine is made up of 3 parts: the duodenum, the jejunum, and the ileum. Hookworms can bother any or all parts of the small intestine, although it is most likely to be in the ileum, as that portion is the longest.
In a healthy dog, absorption is the most important function of the small intestine. Hookworms enter the body through ingestion of feces, dirt, and any other contaminated substances. They travel through the digestive tract until they reach the small intestine and latch on. Fats, small proteins, and polysaccharides enter the small intestine and are broken down in order to pass through the membrane into the blood. The hookworms create lesions in the intestine, preventing these nutrients from entering the blood and being available to your dog. This in turn causes diarrhea, lethargy, and weight loss.
Oh, so the worms eat all the food in her stomach?
No, they actually latch onto her intestine. Let me diagram it to show you.
Here is how nutrient absorption should happen in a healthy animal. In the small intestine, 3 major substances are absorbed: fat, proteins, and polysaccharides. The fats are broken down with bile and lipase into small fat droplets that collect as micelle. This in turn creates chylomicron, which travels through the lymph and drains into the vena cava of the heart. Proteins in the small intestine enter as small protein units and are split into trypsin, chymotrypsin, and carboxypeptidases. These become peptides, which then are broken down by peptase into amino acid, tripeptides, and dipeptides. These then travel past the brush border and into the bloodstream. Lastly, polysaccharides are absorbed. The 3 types of sugars that are absorbed are sucrose, maltose, and lactose. Each of these are broken down by their respective enzymes: sucrase, maltase, and lactase. Sucrose is broken down into glucose and fructose. Maltose is broken down into 2-glucose, and lactose is broken down into glucose and galactose. All of these are able to now travel into the bloodstream. However, the presence of hookworms disrupts this healthy process. The absorption is interrupted and the animal's body cannot receive the nutrients it needs. Hookworm eggs are passed in stool and hatch in the soil after 1 to 2 days. Larvae emerge and live in the soil and can live for up to 3 to 4 weeks. After 5 to 10 days of development, larvae are able to cause infection. Once ingested, the worms are able to pass through the digestive system until they reach the intestine. Once the worms are inside the intestine, the larvae develop into adults. They attach themselves by their mouth to the lining of the upper small intestine, where they feed on blood and produce substances that keep the blood from clotting. The lesions they create disrupt the brush border and allow blood to flow into the intestine, preventing nutrients from being able to exit the small intestine and enter the blood, or the lymphatic system.
Okay, so how do we get rid of hookworms?
I'm going to prescribe pyrantyl pamoate, also known as Strongid. You can get the medication in a tablet, suspension, or paste. Which would you prefer?
The tablet.
Okay, pyrantyl does not directly kill the hookworms, but forces them out of the dog's body where they cannot survive. It has 2 effects on hookworms. It forces the worms to release their grip from the intestines, and then paralyzes them so they're passed in her stool. The worms will no longer be inside her intestines, meaning the digestive tract will no longer be disrupted by them, allowing normal digestive functions to resume.
Is it safe for her to take? What are the side effects?
Your dog's intestines don't absorb Strongid well, so she's unaffected by the neuromuscular blocker. She may have some diarrhea while she passes the worms, but should be okay after that. You'll want to make sure to pick up after Bindi right away if you have any other dogs. As Kaylee said earlier, hookworms is the most commonly passed to other dogs by the ingestion of worms via fecal matter or soil. You'll also want to wash your hands after cleaning up after her to ensure that you do not come into contact with any other of the worms.
You should bring Bindi back in next month to make sure she is clear of the hookworms. Please send us updates throughout her treatment process.
Thank you for your help.
Of course.
Have a good day. Goodbye.